Hello there and welcome to another episode of your AKT Podcast. In this podcast, we're going to focus on pharmacology and the indications and licensing of certain medication. So what I'd like you to do in this podcast episode is pause the episode and have a think about the medication Dapagliflozin. Now, on the 10th of December 2021, there was a drug safety update by the MHRA for the use of Dapagliflozin. So firstly, I'd like you to think about how does Dapagliflozin work and which of its previously licensed indications should Dapagliflozin now not be used within. So the first part of this question directly relates to the mechanism of action of Dapagliflozin. So Dapagliflozin is a sodium glucose cotransporter 2 inhibitor, so an SGLT2 inhibitor, which acts to improve glycemic control by reducing glucose reabsorption, and it increases urinary glucose excretion. Now, moving on to the drug safety update, Dapagliflozin 5 mg should no longer be used for the treatment of patients with type 1 diabetes as an adjunct to insulin in patients who had a BMI of greater or equal to 27 when insulin alone does not provide adequate glycemic control despite optimal insulin therapy. So it can no longer be used within that indication. Now, AstraZeneca had taken the decision to remove the type 1 diabetes indication for Dapagliflozin. However, other Dapagliflozin 5 mg and 10 mg indications are not affected by the licensing change, which ultimately means Dapagliflozin remains authorized in adults for the treatment of type 2 diabetes, for the symptomatic chronic heart failure patients who have a reduced ejection fraction, and also for the treatment of chronic kidney disease. The use of Dapagliflozin 5 mg treatment for type 1 diabetes did require additional risk minimizations for DKA, such as patient alert cards, and given that the Dapagliflozin 5 mg indication for type 1 diabetes has now been removed, the additional risk minimization measures which were present against DKA will no longer be required. This information was taken from the MHRA drug safety update on February 2022, and it is important that you do keep up to date with newly published guidance and updated guidance from the MHRA. Thank you so much for listening. I hope you found this episode helpful. It's a little bit different to some of the other scenarios that we've done, but I was hoping to demonstrate the importance of using the MHRA guidance when preparing for the AKT. This podcast is hosted by wellmedic.co.uk. We help GP trainees pass the AKT.